Hello everyone, hope you guys are having a great day. Today I would like to hop on and talk about the two top tips from an OT's perspective to have a healthy shoulder. Shoulder is very important, a very important joint for us to keep them healthy. We have to lift our arms, elevate our arms to do a lot of tasks overhead. For example, reaching the dishes in the overhead cabinet or switching the light bulb over your head. Also, reaching back for putting on clothes, putting on bras for ladies, for musicians playing music instruments, or for a lot of different types of workers using many tools throughout the day, you need a range of motion of the shoulder. Then, a lot of the shoulder conditions, diseases that set in can really be debilitating, especially if the shoulder range of motion is compromised. For example, frozen shoulder is a very common condition we heard of. Sometimes the rotator cuff muscles and tendons got inflamed or even got torn, things like that, and many other types of traumatic shoulder injury or fracture, things like that, that can be very debilitating if the shoulder range of motion is being very compromised. So it's very important to keep our shoulders healthy, and today I would like to talk about the two tips. The first is you need to have very good amount of spinal mobility, especially the top part, the thoracic spine. You need that part of the spine to be very mobile in order to have the normal range of motion of the shoulder required for a lot of the elevation overhead activity. I would like to personally recommend you guys, when doing a lot of the exercises, use a PVC pipe. It's a good thing to do to facilitate the spinal movement, to give you very good feedback to facilitate the spinal movement required for the shoulder range of motion. You just simply put that stick behind your back, just hold it right there, and then put your arms to your side. You don't even have to move, you already feel like the PVC pipe is giving you very good feedback, and then you are doing many different exercises, different directions from here that usually will promote better spinal movement during shoulder range of motion exercises. That's a very good tip. We talk about proper spinal movement should happen when shoulder exercise or any type of shoulder movement is happening. That's the first tip. The second tip is shoulder stabilization. You need to constantly activate the muscles around the shoulder blades at the back part of your shoulder, and also the rotator cuff muscles connecting the shoulder blade into your humerus bone, the upper arm bone, the rotator cuff muscles. You need all those muscles to constantly be activated to stabilize the shoulder joints. That's how a healthy shoulder should be having. It's the constant stabilization while you are moving the shoulder, moving the arm. A lot of time, a lot of the people, they don't have the proper stabilization. They have the pec muscles jumping in to compensate. They got compensation from the neck, from the top of the shoulder. They got a lot of other muscles that are not designed to jump in and activate during shoulder range of motion, and that's why most of the shoulder condition are happening. It's because of that. So shoulder stabilization is also very exercise. That's the second tip that's very important for the shoulder health. So, from an occupational therapist's perspective, to prevent any types of shoulder condition, non-traumatic condition, or just to promote the general health of your shoulder, you have two things to focus on, like I said earlier. The spinal mobility, especially the upper thoracic region, as well as the proper shoulder stabilization. If you have any questions, give us any comments, feedback, anything like that. We would be happy to address any question for you. My name is Andy Zan, physical therapist, occupational therapist, as well as a Pilates instructor at CORE Therapy and Pilates. If you guys have any questions in regards to shoulder issues, in regards to any other issues of your whole body, or question about the services we provided here, PT, OT, Pilates, gyrotonic training, feel free to give us a call at 512-215-4227 or visit us at our website therapyandpilates.com. We would be happy to clarify any questions you may have. That's all I got for today. I hope you guys have a great day. Bye everyone.